Hi, my name is Natalie Gunning. I'm a physical therapist with Spalding University. Today I want to show you a few exercises for patellofemoral dysfunction. Your patellofemoral joint is where your patella, your kneecap, and the bottom of your femur intersect and form a joint. So whenever you run, walk, bend your knee, your kneecap glides over your femur. Sometimes the structures around your kneecap or knee that help hold it in place get too tight or too loose. Sometimes you might have weakness in your hip, improper positioning of your feet. There's a bunch of different things that can happen that makes your knee a little bit less stable. When this happens and your kneecap moves up and down, it doesn't move up and down in the exact plane it needs to, and it can cause a lot of pain when you do anything such as bending, lifting, running. Sometimes you'll have popping and clicking in the knee. Usually it hurts after sitting for a long period of time and standing up. Sometimes it feels like your knee's going to give out, and a lot of people complain about pain when going down the stairs. So again, this affects females a little bit more often. The reason is our general anatomy. We tend to have wider hips, which gives us what's called a greater Q angle, which is from your hip to your knee. So the more angle that your femur bone has, the more pressure it puts on the medial or inner part of your knee, which can cause added stress on your ligaments there as well as your patella. So I'm going to show you a couple different exercises that are geared toward the hip and the knee in order to help your patellofemoral pain. Please clear any of these exercises with your physician or physical therapist. We don't want to do anything that might make your pain worse. Or if you're not suffering from actual patellofemoral dysfunction, these exercises may not be indicated. So let's take a look and see a couple different exercises we can try to see if we can help that knee pain. The first exercise I'm going to show you for patellofemoral dysfunction is the clamshell exercise. So it works our hip muscles to help keep that patella in line. So you're going to start out on your side. You're going to put your feet together, knees bent, and your feet stay glued together the entire time. Then what we're going to do is lift this top knee up just to the point before I feel like I'm going to start rocking backwards. So about here, pause, and then slowly lower down. You're going to do 10 to 15 reps. If this is too easy, you can always add a resistance band. And you're going to do 2 sets on each side. And you'll start to feel a little bit burning right here in the side of your hip. The next exercise, you're going to flip on your back. You're going to have your feet about hip width apart, and you want to make sure your knees stay straight. So you don't want them to bow out or bow in during this exercise. You're going to plant through your heels, so you should be able to wiggle your toes. This is called a bridge. You're going to lift your butt up as high as you can, pause at the top, and then slowly lower down. 10 to 15 reps, 2 sets. Sorry, my dog made a little appearance. And then the final exercise you're going to do is a straight leg raise, but we're going to work on our VMO, our vastus medialis obliquus, which is a muscle that often gets weak and can help keep that patella where it needs to be. So you're going to straighten out one leg. You're going to turn your foot at a 45-degree angle and hold it. You're going to lift your leg up as high as you can until it gets about to your bent knee. Pause, and then slowly lower down. Make sure you keep it at that 45-degree angle. You don't want it to turn up or turn too far out. And we're going to do 10 to 15 reps on each side of these. And those are just a few easy exercises for patellofemoral dysfunction. Thank you, guys.